Pandemics are known to cause poor mental well-being and an increased risk of mental disorders. There were many surveys conducted on the general population related to the effect of COVID-19 and its psychological impact. But there is a sparse literature on how the containment measures affected the psychiatric patients. So we thought of doing a survey to study the effect of lockdown on mentally ill patients and their caregivers. Hello everyone, myself Dr. Jayashree Janagam, Assistant Professor, Department of the Psychiatry at NHRIMH, Kottayam, Kerala. The title of the study was The Effect of a Lockdown Due to the COVID-19 on Mentally Ill Patients and Their Caregivers, which was a cross-sectional study. As we all saw that the WHO declared COVID-19 outbreak as a public health emergency, and there were many countries to impose a lockdown to restrict the spread of COVID-19. The same thing which we have seen in India as well. With these stringent containment measures, we have taken care of the physical aspect of the disease, but I feel the impact of psychosocial issues has not been thoroughly addressed, especially on the people affected with mental illness. In India, we saw a strict lockdown in the month of March, April, May in the last year, which created a huge effect on the population mental health as well as the people with pre-existing mental illness and also the substance use disorders. These patients are vulnerable to COVID-19 infections. They also have similar fears and stress as others, which may worsen their previous or existing mental illness condition. By social isolation, they may become more withdrawn, moody, and irritable. They may not seek or get easy access to medication due to the strict lockdown. These patients are required a constant assistance in their daily activities, and this often places a major burden on their caregivers as well as their entire family, thereby placing the caregiver at greater risk of mental and physical health problems. The primary objective was to investigate whether the COVID-19 related lockdown affected the subjective mood and behavior of the psychiatric patients and their caregivers. The secondary objective was to assess the difficulties encountered in procuring medicines and the effect of non-availability of homeopathic medications. With this questionnaire, the questionnaire was prepared in consultation with the psychiatrist, which contained 22 related questions to assess the effect of lockdown on psychiatric patients and their caregivers. It included the following components: the questions related to the age, gender, marital status, the work profile, the relation of the caregiver, and the other 14 questions about their existing mental illness, the questions related with difficulty in getting the medication, both allopathy as well as homeopathy. The question about reaction to the news through TV, social media, family relation during the lockdown, and their habit of substance abuse and withdrawal, and how it affected one's mood, emotion, feeling, the behavior in different aspects of life has been devised. The other right questions about the caregivers, about their emotional and mood changes, difficulties faced in managing mentally ill patients, support received, and the general hygiene measures during the COVID-19. The psychiatric patients are those who visited to the NHRIMH OPD immediately after the lockdown in the month of June and July 2020 were studied. It was a manual survey. The filled survey forms compiled in the Excel sheet format and analyzed by using SPSS software. Finally, we could able to get 548 responses, which considered for the analysis, which were meeting the all criteria. In most of the cases, the caregivers were parents, 56.6%, the spouse, 21%, and 10.6% of the cases were not having caregivers. This we can say that the people with a good insight, The mean duration of the illness was 7.5 years. 54% of the patients found a difficulty in procuring homeopathic medications during lockdown, whereas few patients, that is 18%, found difficulty in getting allopathic medications. In this pie chart, we can see that 70% of the patients were not on allopathic medications. So these are the patients only on homeopathic medications. Watching the television among the psychiatric patients found to be more frequently using the social media during the COVID lockdown time. Mental health condition of 50% of the caregivers emotionally disturbed during the lockdown compared to the pre-lockdown. And 205 caregivers could not be able to manage their finances, which was a major stress factor during the lockdown. In this survey, the psychiatric patients showed that distress because of the lockdown were 53%, whereas 47% patient did not show any distress. Though the lockdown was distressing to the patient, but worsening of the existing symptoms observed only in 26.5% patients, and 65.5% patients did not have any worsening of the symptoms. This we can attribute towards homeopathy because, as we saw in previous slides, 70% of the patients were only on homeopathy. The minimum dose and repetition is a hallmark of homeopathy, and probably the long duration of action of the minimum dose might have created such a stability in their mental state. When we see the family relation of these patients were not affected much, only 54.7%, and 20.3% of the patients showed improved relations. These are the stocks of the patients who were happy to spend quality time with their family members, which was not otherwise possible. 13% patients showed conflict in the family, 3.3% showed distance in relation, though it is negligible. Still, we cannot deny the domestic violence. It came up for 0.3% in the study. Among all psychiatric patients, only 10.2% patients responded that currently they are using alcohol. 8.8% patients are using tobacco and smoking. 0.7% of patients are shown using other substances, and they were using these substances on an average since more than 8 years. Though the lockdown was restrictive, but 6.6% of the patients responded that these substances were available to them. A small portion of the patients informed that they could not procure these substances, hence they used other alternatives such as excessive coffee, vinegar, etc. Our survey shows 50% of the caregivers suffered from emotional disturbances and in this lockdown. And however, when they question about their mood, 33.9% of the caregivers responded that their mood was cheerful. 26.7% reported being sad. 21.7% were anxious. 4.9% suffered from anger and irritability. The previous study shows that caregiver experiences enormous burden during providing care of their relatives with mental illness. But in our survey showed that 47% caregivers did not feel that psychiatric patients are a burden to them. 40% caregivers responded them as a burden during the lockdown. An estimated 12.2 crore people have lost their jobs due to the COVID-19 pandemic, resulting in increased financial crisis. In our survey, 37.4% of the caregivers responded managing finances was a major stress factor during the lockdown. Our data also showed that 75% of the patients could maintain the social distance, mask, and hand washing measures. So, managing the COVID 19 guidelines among the psychiatry patients was not a much problem. We do faced a lot of challenges in collecting the data from the psychiatric patients. The patients with the poor insight were not ready to accept that they were mentally ill, so they were not ready to participate in the study, and thereby we got only 548 responses, and the response rate was only 41% in 2 months. One more challenge was to fill the questionnaire, and the questionnaire which we prepared contained only 22 questions. Still, it took a lot of time in making the patient as well as the caregiver to understand. Even we explained it in their local language, but still it consumed a lot of time in making them to fill the form. The limitations of the survey was that we conducted it on all the psychiatric patients. So evaluating the stress factors in the particular disorder was difficult. The global attention was more on general population, but our findings showed that the pandemic affected the mental health of psychiatric patients, and there is a need to plan the strategies to enhance mental health services, and also the necessary measures should be taken to improve the accessibility of homeopathic medications with the institutional care to the psychiatric patients. These are the references of the study. This is a link one can go through. This is a link published in the International Journal of Community Medicine and Public Health. Let me acknowledge my co-authors, Dr. K.C. Muralidharan sir, who is our in charge, Dr. Pradipti Jilla, she is my colleague, Dr. N.J. Mohan, who is a psychiatrist of the institute, without whom I can't imagine this survey to happen. And let me thank the SciTech Central Conferences for providing me this platform to present my papers. Thanks a lot for patient listening.